Okay, let's get started. Good afternoon, everyone. My name is Eli Steiker Ginsburg. I'm the communication manager for the Pennsylvania Nutrition Education Network. Thank you all so much for registering and attending this webinar, Advancing Equity Through Community Engagement. We're joined today by Latresh Davenport, who is the program manager for SNAP Ed at the Georgia Department of Human Services. She brings a wealth of experience and knowledge to this field. Thank you so much for your willingness to present. Latresh, I turn the floor over to you. Sorry, just one quick note. Please put any questions in the chat or in the Q&A section. I will do my best to kind of moderate discussion after the presentation. So any thoughts that come to mind, comments, questions, whatever, please feel free to put those in the chat or in the Q&A, and we'll try and get to all of them at the end. The runtime will be about an hour. But any flexibility we will see. So thank you again, Latresh, and the floor is yours.
Thank you. I appreciate the introduction. Well, thank you again for joining on this lovely Friday. My name is Latresh Davenport. I work at the Georgia Department of Human Services in the Division of Family and Children's Services. And as you can see, I'm at the state agency, so I'm not an implementing agency. And the work here is a bit different than implementing. And so I'll kind of share our journey and how we've tried to center community voice and how that advances equity. And some of our wins and some of our challenges and pain points. So we'll kind of walk through kind of how we've oriented equity and our influence from design justice. Some thoughts around kind of building internal workforce skills and what that looks like, building relationships. So strengthening that internal support, really reaching outside of your organization and seeing who might be folks who can support this work and advance it at their agencies, where we are now, what are we up to, and where we hope to go in the future. And in that, I'll try to kind of share like I said, some of our successes and where we are and where we plan to go and some of our pain points. So just an introduction about Georgia. Our SNAP Ed program is a fairly large one. We have 4 implementing agencies. The staff at the state agency is myself, and I have a colleague. And we work on a couple of initiatives at the state. The 4 implementing agencies serve about 119,000 SNAP Ed eligible Georgians. The vast majority of our work is centered and focused on addressing food insecurity, nutrition security in marginalized communities. So it's a really diverse state. It has several there's some very really busy urban parts like Atlanta and Savannah and Macon. And then there's very, very rural parts of our state, like Burke County and some of the North Georgia mountains can be a bit different. So as you can imagine, with different parts of the state, you're going to need kind of different lenses and different approaches to reach people. About 44% of our SNAP recipients are under the age of 18. About 22 of our SNAP recipients identify themselves as disabled. And right now, the composition of our implementing agencies is 1 state health department, 1 university, and it's a land grant, and 2 nonprofit organizations that are serving multiple counties throughout the state. These are all our current sites. We have a little over 400 in about 67 counties. Georgia has, I believe, a total of 135 counties. There's lots of counties in Georgia. You can kind of see where there are gaps, and I'll talk a little bit about how we're addressing those. And we have a variety of programming. We implement community guardian, food policy councils, school-based train the trainer programs, student health advocates. So really supporting, providing training and technical assistance to students to support physical activity and nutrition in school settings. Cooking Matters classes, food e-talk classes, which are online nutrition education classes where participants can go at their own pace. We have a couple of social marketing campaigns, and they include our Hydrate My State campaign, the Fresh Marta markets, which are farmers markets within the public transportation system. That's mostly in Fulton and DeKalb, and Eat, Drink, Move, and Healthy Childcare Georgia, which focuses on early care and education settings. So lots of programming, have a very large variety of programming, and we work in a lot of settings. So, some of the strengths of our program are we have a broad range of programming. We have a variety of funded partners, and the work that we do, I would say that there's a good mix of direct nutrition education, social marketing, and PSC. Most of our partners are doing multi-level interventions. And so we're really excited about how our implementing agencies have kind of taken on that task of really expanding on nutrition education. And so, given that we're doing really great, there are also opportunities for improvement. So one is, how exactly are we centering community voice in this work, in our design, in our implementation, our planning, and our evaluation and sustainability? How can we expand the number of people that we, the institutions and organizations that we fund? And how do we expand success? We have traditionally stuck to the SNAP evaluation framework, but might there be other ways to kind of think about how we come to this work and how are we defining what success looks like? So broadly speaking, this is a very broad definition of equity. And so I separate them by process and outcomes, and really processes like how the program and staff engage in practices that advance equity. And they include improving equitable access to programming, so ensuring that our outreach, the number of people in our classes, the benefits of our PSC program, our reach for social marketing are equitable. Practices that shift decision-making power to marginalized communities. How are we incorporating processes and practices that really incorporate community voice? Who needs to be in charge of that? What skills need to, kind of skill building activities should we implement in order to better facilitate that within agencies? How do we kind of broach this work to community members as we're out doing this work? And how do we collaboratively define success? We have typically defined it and used measures solely based on the SNAP evaluation framework. I will say in the state of Georgia, we have been aggregating data from all 4 implementing agencies since 2017. And I only collect, I believe, MT1, MT2, MT5, and MT6. And those have been kind of how we have looked at our program impact, what is successful, and how we have defined that has been based on the SNAP evaluation framework. And so might there be opportunities to expand that? And for outcomes, what are how can we better support the work that we do? How can we make the programs more relevant so that we can have more equitable outcomes in diet related and physical activity behavior change? How do we share the benefits from SNAP-Ed programming? So how do we expand beyond nutrition education and really support policy systems and environmental changes? So really getting to how structures are encountered, and how do we support structures, institutions, policies, and practices that really support better dietary decisions and better physical activity decisions. Diversifying our workforce, specifically in SNAP-Ed, shifting funding towards historically excluded community partners, and what exactly are the material benefits for SNAP-Ed eligible participants? And so, so that's our initial kind of orientation. And I was doing some research around how to do this work. And I ran across this framework that I thought was really helpful and could be really applicable to SNAP-Ed and the work that we do in Georgia. So design justice was one kind of lens. And design justice is work that has typically been around tech. So how AI and how apps and how technology in general are used and developed, and how might they be designed so that they really center community needs. And so practitioners that work in social movements and community-based organizations and designers and developers and technologists and journalists and community organizers and activists all kind of loosely created this network of design justice practitioners in 2015. And the goal was really that practitioners develop a set of principles that would not reproduce existing inequalities. And so the broader definition for design justice is that it is a framework of analysis of how design distributed benefits and burdens between various groups of people. Design justice focuses on explicitly on ways that design reproduces and or challenges the matrix of domination. It aims to ensure a more equitable distribution of design's benefits and burdens and meaningful participation in design decisions. It wants to recognize community-based, indigenous, and diasporic design traditions, knowledge, and practices. And so from that convening in 2015, practitioners put together some guiding principles. And I thought that they could be really applicable, again, for the work that we do in SNAP-Ed. So they include, we use design to sustain, heal, and empower our communities as we seek a liberation from exploitative and oppressive systems. We center the voices of those who are directly impacted by the outcomes of the design process. We prioritize design's impact on the community over the intention of the designer. We view change as emergent from an accountable, accessible, and collaborative process, rather than as a point at the end of the process. We see the role of designer as facilitator rather than expert. And we use design to sustain, heal, empower our communities, as well as seek liberation from exploitative and oppressive systems. We center the voices of those directly impacted by the outcomes of the design process. We prioritize design's impact over the communities, on the community over the intention of the designer. We see the role of the designer as a facilitator rather than an expert. And, oh, I think I put those two slides together. We believe that everyone is an expert based on their own lived experience. We share design knowledge and tools. We work towards sustainable, community-led, and controlled outcomes. We work towards non-exploitative solutions, and before seeking new design solutions, we look for what's already working in the community. And so the principles really got me to thinking, how might this look in a SNAP-Ed program? I know that this framework was developed for tech, but the practitioners come from a variety of fields. And I think one of the more interesting things about this group is that they do encourage other practitioners from other fields to join into this work. And so kind of thinking through what this might look like for SNAP-Ed, I kind of jotted down what would be some things, some specific actions that we would see if we applied some of these principles in nutrition ed and the SNAP-Ed program broadly. So for sustain, heal, and empower our communities, encouraging our nutrition education classes to be environments where community knowledge is shared. I know a lot of our nutrition education classes already do this, in addition to sharing recipes and best practices for preserving fresh produce. They also share as a really great space to share other community knowledge where people are coming together. Another is implementing a trauma-informed to a healing-centered approach for nutrition education. So really thinking about healing practices, addressing any trauma that might be occurring within the community instead of not recognizing it. And really going beyond educating people about how to eat healthy and really think about incorporating education around what a food system is, how it works, who are the decision makers, who are kind of the power brokers, so to speak, and how exactly do we affect change on systems in addition to individual behavior change. Center the voices of those who are directly impacted. So thinking about who suffers from some of the poor health outcomes and how can we really bring in those folks to inform and plan and implement and sustain programs and its benefits, and really compensating community members for their time and expertise. And this can be through stipends or gift cards, letter of recommendations, hiring community members as consultants, and considering community members for co-authorship where applicable. Prioritizing design impact on the community. So really developing a feedback loop to gauge program benefits. So in addition to the benefits of kind of gaining information around better eating habits and better physical activity habits, what other program benefits might there be, might we see, and how might we be able to gather that information from community members that have completed our classes? Who collects data and what's on it? So again, thinking about how what information we collect. Also really important to think about what information we collect and we don't use, and really rethinking about collecting data that you don't use. Developing a more participatory boards, advisory commissions, accountability commissions, listening sessions to gather feedback from community members about how the impact of your program is felt amongst community members. And there's lots of ways you can do this, but again, it's a bit different from kind of doing a post-test. This would be after a post-test. This would, you could also do this through focus groups, but it would give you a feedback loop into understanding, okay, we've done this work, we've done the PSE, we've done the social marketing. What was the impact in the community? What was felt? How were you treated? Were your ideas incorporated? Was there any opportunity for you to share your ideas and your feedback? Did that social marketing campaign not resonate with you? And how exactly is that information used within institutions, organizations to inform and improve programming? And really also developing that participatory evaluation methods that don't just collect kind of quantitative results, but also those qualitative results as to the why behind the data. So we get the what, but the why is really also important. And we want to be able to contextualize the data that we collect. Change as an emergent from an accountable, accessible, and collaborative process. Again, thinking about what policies and practices should be put in place to create a more collaborative environment where we are working with communities and not to communities. And so this could include really thinking about how our institutions and programs and practices accountable to community members. Are there any mechanisms to do that, and what accountability might look like? Are these processes to create, to provide feedback accessible? So are we providing these sessions only in English, only doing during business hours, not providing ASL interpreters? Those are really important because if we continue to gather information from the same people, it's unlikely that we'll be able to determine if our programs are really working for the broad array of people who are SNAP eligible. And ensuring that that process is collaborative. There can be real power dynamics to address when you're doing work that's more community centered, and addressing those power dynamics, addressing the fact that you are working for an institution is really important, because it's going to give you an opportunity to say up front, here's the power dynamic that exists. How can we mitigate those? How can we make sure that I'm not the last person to make decisions? Or if I am the last person to make decisions, what goes before that? Do we have a discussion? How are decisions made? Is it majority rule? Is it consensus? So really thinking about a process for collecting and informing program practices that are accountable, that are accessible, and collaborative. Designers as facilitators rather than experts, really thinking about nutrition educators, evaluators, program coordinators, directors, PIs as facilitators rather than experts. They have a level of expertise, and that expertise in partnership with community members can really be maximized. And so really thinking about our role as more facilitators and not as the only experts in the room is really important. So how do we go about co-development, which is a bit different than decisions that are typically made behind closed doors within our institutions? What does it look like to really think through what decisions are made? How many decisions should we kind of hand over to community members? We don't want to introduce ourselves and say, hey, we want you to make decisions about all these things in our program, our processes, our evaluation. That's a lot for community members. And so kind of being more intentional about what might be realistic. How can we acclimate community members to this kind of new way of doing work? How do we acclimate our staff? How do we make sure we have the skills to really be facilitators in this work and not kind of controlling of this work? And thinking through how flexible, how responsive organizations and institutions are to receiving that feedback. And so everyone is an expert based on their own lived experience. So this, again, really speaks to how community members, in addition to practitioners coming together, creating solutions is best practice, or the North Star, so to speak. So everybody brings a level of expertise, but also thinking about how do we make sure that we're including all voices, that we aren't dominating conversations, that we're including space for folks to speak up and that people feel comfortable. If there is a collaborative paper or a curriculum that comes out of this work, how do we make sure that community members are compensated, that they are attributed, that their names are included in press releases and any media that we do. And if there's a curriculum and you're making profit from those, making sure that we're sharing those profits with community members because they have shared their knowledge and expertise with us. And that the knowledge that we create from the surveys that we give, the focus groups, community circles, are always really shared back with community members, whatever that capacity looks like. That information doesn't stay within our institutions, but it really gets spread as far as we can, and that there is kind of a process for thinking through what that means. Share design knowledge and tools. So really thinking about, again, if we're approaching this work as community members, as partners, then we don't want only our staff to have the skills to do, to understand data, to collect information, um, to be public speakers, how to run a social marketing campaign, how to build consensus. Those are also really important skills for community members and leaders. I think in the SNAP evaluation framework, they're called champions. So being really intentional about that knowledge transfer, that skill building that should happen. So, and then really incorporating that into sustainability plans, so that we're also thinking about sustaining programs and interventions beyond kind of the time that we're there, and really thinking about skill building for community members and making sure that whatever institutional knowledge doesn't stay within the institution, that we're really sharing that information out. Creating sustainable community-led and control outcomes, kind of thinking through what is the gold standard for the work that we do. We do want to, create programs and interventions that will last beyond our time, but also thinking about who's going to control that, who's going to get the benefit from that, and really thinking about how can we, and communities are where they are. And so they might not recommend or suggest a community controlled or community owned solution. So like a co-op or something along those lines. But there might be real opportunities to think about how can we, when we are kind of menu of options of what's possible, that we also really think through how can we share information with communities about how to influence decision makers, how to make sure that we are transferring control of kind of community solutions to community members, and really thinking through what does kind of a community-led, community control solution look like, right? So, in order to do this kind of work, community members have to work together. Community members have to kind of have some type of decision-making process. So again, not just for us, but also for community members, what it might look like, because that would be the gold standard. And really supporting non-exploitative practices. Don't take information, knowledge, skills, and not get back. Be as transparent as possible. Working for a state agency, I understand that there are limitations, but being as transparent as possible is going to be really important. It's going to build those relationships that you'll need in order to really do this work long term. Sharing the credit, including people in presentations and authorships, and press releases and media, if you're doing interviews, really making sure that we are sharing and crediting coalition members or coalitions broadly if we have been working with them and they've made really substantial contributions to the work that we do. Creating inclusive interventions, of course, thinking through who benefits from interventions. Of course, we want to share knowledge and skills, but what other ways might there be benefits, and how do we make sure that we are sharing those with community members? How do we make sure we're not doing harm? And really creating those feedback loops to ensure that if there is harm, if there was a decision made that community members find unfavorable or harmful or exploitative, that there are remedies for that. And before thinking new designs and solutions, we look for what's already working. It's really important to think about, approaching community members through an based lens rather than a deficit, and look at what's working. It might not be kind of complete, it might not be groundbreaking, but it's working for them, right? It might be a mutual aid that people in the community have started up as a way to share their produce, their food with community members that don't have produce, who are food insecure. What are those skills? Where are the champions? And where might we be able to support that work? Where might we be able to provide a system so that we're not kind of overly burdensome folks with kind of these huge asks of supporting kind of more than they might be able to handle. And really thinking about, again, if we're going in and we're thinking about what are the assets and we're supporting work that's already moving forward, that's okay. You don't have to always come up with something new and something exciting. You can actually just support where it works for their community, and that's a win. And so where did we start? So we started kind of thinking through what were some ways that we could approach this work in a way that made sense for us. So this approach was from Race Forward's A Way to Work. And its process was around normalize, organize, and operationalize. So normalize was really the phase of creating that racial equity framework, operating with urgency and accountability, really thinking through, what is equity? How does it look like in programming? What's allowable and what's not allowable? What's possible and what isn't possible? The second is really organizing. Who else is really interested in this work, and how can we lock arms to do this work together? How can we build internal capacity? So whether that's, I would really like to do this work, but I can't do this work with just me, right? Part of the reasons why we've done work this way is because it's just me and I don't have the capacity to do kind of community engagement work. So do you need another staff? Do you need to hire external partners? Is there any room in any of your implementing agencies' budgets to do this kind of work? And then partner with other organizations and community members to do this work. So there's, kind of building that internal within SNAP-Ed, and really where are your partners outside of SNAP-Ed who could also come alongside you, your organization, and really expand and advance equity. And then operationalize. So that includes things like implementing racial equity tools, such as assessments and equity audits, and being really data-driven and sharing that information broadly so that folks can get a really good idea of where we're going and where we are and how far we have to go. This work is a process, even after you obtain goals, and I think that's great and awesome. There's always more work to do, and so it's really important to see this work as really, really iterative and really building upon each other. So I have worked with the Public Health Institute to develop a workforce assessment, and that workforce assessment was created from a couple of different assessments. So it included the practice principles for health justice and racial equity, the Bread for the World institutions applying a racial equity lens to anti-hunger policies, and Race Forward's racial equity impact assessment guide. And it was more along the lines of asking work for SNAP-Ed implementing agencies practitioners around how comfortable they felt around doing equity work, how interested they are, how familiar were they with equity principles, how familiar were they in talking about race and ethnicity with not only their staff, but with community partners, and really using that information to plan out trainings and TAs. At the state agency, we drafted equity-centered goals and objectives, and they included things like making sure that we are collecting good data. That's really going to be important as we move forward, making sure that we are disaggregating data. Like I said, we've been aggregating data from the 4 agencies around MT1, MT2, MT5, and MT6 for about since 2017. but we hadn't always disaggregated that data. And so we disaggregated the data by race, ethnicity, by gender, by language, and we did some other equity mapping. And so we looked at that information to really give us a good idea about where is our programming working and where it wasn't working. What are the groups that weren't kind of meeting best practices benchmarks, and how I'm really thinking through how do we address those gaps. Like I said, we developed a series of training and technical assistance to support equity-centered programming. So we've done, I believe, 4 trainings. One was kind of a grounding foundation around health equity. The second was community engagement. The third was around PSCs and how can we incorporate equity in that work. And I believe the last one is at the end of this month, and it's going to focus on evaluation and sharing results with community members and really thinking through how to make sense and meaning making of those results. We're working with PHI in the Southeastern Regional Office, us in about, I believe 2 or 3 states, I believe, I might get this wrong, North Carolina, South Carolina, and Mississippi to complete some equity maps. So mapping where people are versus where our programs are, and really looking at those gaps and seeing where our partners. We're also doing some gap analysis with our State Nutrition Action Council partners. So that includes Department of Education, the Department of Early Care and Learning. So those are the folks who do CACFP. And I believe we are bringing on another partner. I'm missing someone. But we're also kind of working through, okay, where are we doing work across the state and where are there gaps? They have a list of priority counties. We have a list of priority counties. Is there a way to overlay all of this work and see where we are all maybe missing the mark, and how can we build local capacity for agencies in counties, in census tracts, and zip codes where we're not currently doing work? And that's specifically around nutrition security. And, we've done this work through a couple of ways. And I think what's really important is really setting the vision for what is equity, defining it, and centering it and programming, and really providing training as to how does equity look like? What does equity look like in the direct nutrition education class? What does it look like in community engagement? What does it look like in PSCs? And really providing TA and discussion and opportunities. We've also developed some one-pagers that say, now that you've done the training, here are some things that you could think about. How can we improve workforce capacity for facilitating community conversations? What kind of skills is really important to do this work? So who should we be looking at hiring? So thinking about those next steps, which are going to be really important for implementing agencies as they kind of think through these really big topics and where their point of influence is, and then implementing it throughout their respective agencies. We are also undergoing a strategic planning process. We have gathered information from the state agency, from implementing agencies. We'll also be gathering information from health educators and community members to really think about how they view the SNAP-Ed program, where they want it to go, and really incorporating and centering that information in our broader strategic plan. So we hope to have a draft of that by the end of this calendar year. We established an adult community advisory board back in March. We have met, I believe, 3 times. And we are planning to establish a youth community advisory board. We also plan to facilitate a statewide youth summit, which will really bring together student health advocates in this space to provide some guidance, best practices, barriers, and how they were mitigated to doing this kind of work. We established new funding focused on community-based organizations that were led by marginalized people from marginalized communities. So people who were Black, Indigenous, or people of color, or in places that were historically excluded. So if there were rural counties where we weren't doing work, where we don't have a footprint, really reaching out into those areas, reaching out to those community-based organizations and inviting them in to do SNAP-Ed work. And so some lessons learned is that the workforce, I think one of the lessons learned is that equity work is really important, but equity work takes a lot of time. These can be very difficult times, and deadlines have to be a little bit more flexible. So getting the workforce assessment out and back took a lot longer than we thought. The advisory board, the adult advisory board, we work with our implementing agencies and with other partners to really get the word out. We have to be really clear about the individuals that we were recruiting. So they needed to be SNAP eligible. They needed to have an interest in doing this work. We wanted to ask questions around race, ethnicity to make sure that the board was composed of folks that was very similar to the target audience. And scheduling some of the summertime meetings have been a bit difficult. We hope that we can stabilize in August, which is when Georgia schools go back. Trainings for SNAP-Ed staff focus on SNAP-Ed activity. So, again, community engagement, PSD work, social marketing, evaluation, which is all work that we already do. And we made sure to incorporate equity practices in those trainings so that they kind of served a dual opportunity to reinforce best practices for the work that we already do, and then adding in that those equity practices so that folks will get a really good idea about what that looks like. We mapped and analyzed gaps in our service area and really are targeting and tailoring our work to address those. And we really had to think about, when we initially kind of thought about equity, there were some folks who immediately said we couldn't do this work. And so then it became I wouldn't say detective, but you do need to kind of figure out who is telling you no. Was it the state coordinator? Was it USDA? Was it your institution? Did they give you a why? Because most of this work is SNAP-Ed allowable. It just requires kind of an understanding and maybe a discussion with leaders for them to kind of understand where SNAP-Ed fits in this work. So for our evaluation, we used a kind of combination of the SNAP-Ed evaluation framework and some other data. So for our community advisory board, one of the other lessons learned is that we needed to be very, to kind of provide them with a project. We didn't want folks to come together and kind of think through, 3 or 4 or 5 sessions, trying to figure out what it is that they wanted to work on. So we gave them a project around social marketing. And so, in the short term, really, how are we gathering that information from our community advisory board? Have we increased in investing in kind of the human capital and champions and leadership skill development and doing this kind of work? The number of social marketing campaigns, the number of local agencies that sponsor a discrete or local defined social marketing campaign, and the number of new agencies managed by people from marginalized or historically excluded communities. Our medium term kind of evaluation was around, to what extent are we using kind of SNAP-Ed information data funding, being as transparent as possible in our communication? Have we increased the number of community champions? Are we being intentional about our outreach? Are we being intentional about our leadership development within the work that we do around SNAP-Ed? And what other accomplishments or written audio or visual descriptions of activities and accomplishment by champions have we collected And the last is really long-term, which is how do we think about the results in a more equitable system? So thinking about outreach, program retention. We had a major drop-off of some of our program participants, and we really need to know why. Thinking about fruits and vegetable consumption, the number of sites that support marginalized communities, defining solutions and leading change. So really, what does success look like, and really centering that community voice. Our program benefits, so programs, accolades, attributes, financial funding being redirected to historically excluded communities. And LC 11, which is a number and topics of unexpected organizational activities. We hope that we'll get some other benefits from the work that we do, and other multi-sector attributions. So really thinking through how do we do this work with nutrition practitioners and also physical activity practitioners. And so our timeline was in 2021, we implemented the workforce assessment. In 2022, we drafted the equity-focused goals and objectives. We established a statewide community advisory board. We expanded funding. We invited community-based organizations and other nonprofits to do SNAP-Ed work. And we provided training and technical assistance to implementing agencies. We initiated a needs assessment, which we hope to do in 2023. We hope to also establish a community youth advisory board. We hope to facilitate a statewide youth summit. And we also would be interested in having these community advisory boards really be integral in participatory budgeting and grant making, which is really reviewing proposals and getting their ideas and scoring for who will get funding, and providing recommendations for who would get funding. And in 2022, really establishing a more community-centered learning curriculum, which will be focused on our community champions, really revising evaluation and data collection processes. So making sure that we're incorporating qualitative and quantitative data collection, making sure that we are collecting that information that's going to give us context. We currently use qualitative data as from our success stories, but it doesn't provide a lot of context to MT1 and MT2 healthy eating and active living outcomes. It doesn't provide a lot of context to how we interacted with the community, and did we share kind of power and decision making with them. So we'd like to be a little more intentional about that. Establishing learning circles, so from institutions that are more far along in their equity journey, supporting other institutions, other staff members in this work through learning circles, and then following up with another workforce assessment to determine if we, kind of missed the mark, if we need to try again, and have those trainings and technical assistance sessions been helpful. And so lessons learned. I think when you start this work, what you start realizing is that you haven't done equity work, and that you've probably messed up, and that you've probably done wrong. And that's okay for now. I think it's okay to recognize that this is a different orientation to doing work, and it's okay if you haven't done it in the past. But I also think it's really important to think about what can you do, what's your level of influence to implementing it now. Start where you can, identify your sphere of influence. What can you influence? And how can you be a champion for this work? How can you advance it? So if it's not directly over policy changes, is it through influence? Expanding bandwidth. So if you need more staff, if you need more partners, if you need more time, I don't know if I can give you that, but if there are opportunities to expand the number of people who do this work, do that. Expand your timeline. Whatever the timeline is, probably expand it. Specify if you like, if you like to include representatives from local community-based organizations in recruitment information, make sure that is clearly labeled in your flyers and outreach materials. We're going to do one big community advisory board, and then someone had the suggestion that youth might not be comfortable with sharing ideas in a group full of adults. And so we recognized that, and we separated those community advisory boards based on age. And like I said, summertime scheduling can be a challenge. And reorientation towards equity, you can't think of it like a change management process. it does take work, within individuals and within institutions. It is a process. There is additional work that you would need to do in order to do equity work. It's important, and I think it's valuable, and I think it's really it's a value add. I think it's a great investment. Being grateful for the critique from community members. I think when you do this work, you open yourself up to critique, and it's okay to be okay with critique. And thinking about what should I advocate for, or what should I educate myself about. There's always something new, there's always something different. And I think it's a really good opportunity to always be in the position of a learner. As some challenges that I work at the state agency, I don't implement programs. So what I do is kind of provide what's possible. I provide the training. I encourage agencies to kind of take on this work. And it can be difficult because different institutions have different values and different priorities. So I think part of my work is to really be a champion for it, to provide that support for agencies who really want to do this work. So in summary, start, find your people, try to do this work together within your organization, with your external partners, implement, start where you are. There is a sense of urgency. Yes, expand your timeline, but act with a sense of urgency. Learn as you go, revise, don't keep doing the same things over and over and over again, and then start again. Don't give up on this work. I think the people that we work alongside of are really worthy of great partners, and I think we can be that. So that's all I have for today, which is a bit longer than I thought. Did we have any questions?
Wow, thank you so much, Latresh. That was awesome. Really wonderful presentation. Thank you so much.
Yeah.
If anyone has any comments or questions, please put them in the chat. It looked like Latresh's email was also at the end of the presentation.
Yes.
So if you have any kind of additional follow-up questions that you don't think of in the next couple minutes, totally fine. You can reach out to me as well, and I can forward the questions and answers. I had one question, which was, I get that it definitely makes sense to kind of be implementing this kind of equity framework or justice framework into existing interventions, existing programs. Are you seeing any kind of push for that to be reflected in policy, in how SNAP and SNAP Ed is designed from a policy standpoint?
Yeah, so we do see that, the guidance is not, the guidance is the guidance. I think what would be helpful for folks who are doing equity work is for the guidance to be more specific around what is an allowable cost and what isn't, because that can be a gray area. And so I also work with the ASNA Race, Health, and Social Equity Committee, and we are putting together a position paper that will provide recommendations to a variety of people, but also the federal USDA about recommendations to include equity-specific practices as allowable costs for SNAP Ed. Some agencies are already doing this work, but like I said, it can be an interesting decision based on the state that you're in.
Nice. Yeah, that makes sense. I definitely look forward to seeing what ASNA kind of publishes in terms of their policy recommendations. Because I'm relatively new to SNAP Ed, and my sense is that a program that's designed like for everyone, ends up kind of missing the mark on a lot of on this equity question. And so, yeah, definitely a bit of a tightrope to walk in terms of kind of fulfilling scope of work, fulfilling the contract, while also kind of pushing for kind of maybe enhancing the impact in communities like most impacted by like food insecurity, or who deal with barriers to access on various fronts. So I can see that tightrope is maybe also on a dark stage as well.
Definitely can be. They are not mutually exclusive.
Right.
But I think that I think each and every agency has a priority population. They might not write it in a proposal, but they do. And I think that the work that we do and kind of the information that we collect reflects who is the priority population. And that is really left up to the agency to decide. That's one of the beauties of SNAP-Ed, that there's a lot of variety, right?
Right.
So I think that these decisions are already being made, but they're not necessarily being made through an equity lens. They're not being led by data. They're not being led by community voice. They're being led by folks in positions like us that kind of decide, and then folks just kind of do. So I think it's really important to think about, we are making a decision even if we never say we are.
Mm. Yeah. Wow. Yeah, that's a great point. That's a great point. Let's see, is anything? Okay, looks like we have one comment in the Q&A. It says our CDC funded REACH coalition in our area is currently looking at implementing a racial equity framework into our evaluation. This talk was super relevant to that, and I really appreciate it. Great. Thank you, Mike, for that comment.
Yeah.
So yeah, so it definitely sounds like there's kind of a much broader, and we know this, there's a much broader conversation around racial justice and social equity in SNAP and SNAP-Ed, but of course more broadly and in public health. So I think this definitely a lot of food for thought, just for like how we as kind of implementing agencies can kind of start to have like more inclusive design and more participatory research and design of our programming. And I really appreciate at the end of the kind of your last slide is kind of like the top level summary, it being a really flexible system and a dynamic system, which especially in Pennsylvania, where we have many, many different implementing agencies, more than 4. I think we have close to 20, if not more.
That's a
lot. Each one is doing something a little different. So that flexibility is even more important to kind of double down on and really meet people where they're at.
Yeah, thank you. It's been a real pleasure talking to y'all.
Yeah, thank you so much. I'm going to stop recording.